Welcome to the Business Partners to Convince training session, communication strategies for building vaccine confidence with employees. Please post your questions in the chat throughout the session. We will have time for audience questions after the presentation today. Also note that this session is being recorded. So here are today's learning objectives. We'll cover three main areas during our session today. One, strategies for effective conversations with employees about COVID-19 vaccines. Two, approaches for communicating your company's COVID-19 vaccine and return to work policies. And three, accessing resources for business leadership and employees. So now let me introduce our moderator for today's session, Dr. Scott Ratzan. Scott has 3 decades of pioneering accomplishments around the globe in health communication, health literacy, and strategic diplomacy. He co-founded the Global Convince Initiative. He leads Convince USC at SUNY Graduate School of Public Health, and he leads our BP2C initiatives with the private sector. Thank you, Scott, and I'll hand it over to you.
Great, and thank you, Jen, and I'm really happy to be here today to share with all of you our Business Partners to Convince training session, communication strategies for building vaccine confidence with employees. What's most exciting today is not just to explain how we got here and what we've been doing, but more importantly, to introduce Dr. Jia Hu from 19 to 0. He co-founded this as part of what we were the Convince Network. And then also his great work with the Alberta Medical Association, but I will properly introduce him later. First, to say this global coalition that we launched a year and a half ago now at the UN High-Level Political Forum on Partnerships in July of 2019. If I get this right now, I'm thinking 2020 now that as we're moving along. And the pandemic has offered some odd, shall we say, COVID time. So I often think that way, that we're in this not only for the short term, but we're also in this for the long term. And what the global coalition that's come together has a mission to provide a forum and clearinghouse for multi-stakeholder efforts to manage this complex, nuanced, and immense public health challenge. And we envision this world today still where we can accept and trust the importance of vaccines to keep people healthy and the global economy functioning. And when we organize this, and as you see on the bottom left, I co-founded this with Heidi Larson and Nancy Lee. Heidi Larson, who leads the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, and Nancy Lee of Wilton Park. We organized in a way that we knew this would not be done by one sector alone. So we put together 4 work streams: the healthcare workforce, media and technologies, community engagement, and the private sector. And given the great link with USCIB and the USCIB Foundation, we formed Business Partners to Convince, which is really the private sector arm and the link with the overall Convince Coalition. And as the last thing I'll say here is that if you look at the center, we're aiming for vaccine literacy and acceptance. People need to understand why we have vaccines, how they work, why they're important for everyone, and how they will fit into our scheme now to get back to work or live with this new COVID, new normal, and I often say a COVID protected world, which we're getting to with vaccination. The next slide shows what we came up with in forming this coalition, that business is a trusted source of information, well suited to engage, inform, and educate workers, their families, and communities with a message that inspires confidence in vaccination and encourages acceptance and uptake as COVID vaccines become available. Therefore, we pledge to hear concerns, listen to feedback, and develop vaccine literacy strategies based on science, facts, and emerging information to counter hesitation and vaccination opponents through communication and education initiatives at the global, national, and local levels. And we were fortunate to put this statement of shared purpose together with the great network that USCIB has been building for over 75 years in their USCIB's existence. That's with the International Organization of Employers, this International Chamber of Commerce, business at the OECD, and then a whole variety of others who wish to join on. You might recognize some of these, such as the Australian Chamber of Commerce, some of the other universities that are there, and of course the World Economic Forum and others. But SHRM, which is especially important, that we'll talk a little bit about later, the Society for Human Resource Management also is very much engaged, and hence this training session also links with some of their efforts in a very unique way. So with that, I'm more excited today to not just bring in what we've been doing, but what we are doing and what we can do to work together to address the COVID pandemic. And we've been fortunate that Dr. Hu has been involved with the primary care vaccine rollout at the Alberta Medical Association for some time. He's a clinical assistant professor at the University of Calgary. He's chair and co-founder of 19-0 and a family physician. He also works in the East Calgary Health Center, intercity family medicine practice serving marginalized population. He's a corporate medical director with the Canadian Pension Plan Investment Board and with Cleveland Clinic Canada, and has previously worked in management consulting for McKinsey and as a consultant at LSE, London School of Economics. He's been advising governments on health financing models, and I know has been advising governments and a lot of academics on what to do during COVID, and has some very unique perspectives and some great innovations with Canada. And for all of you who've been following the news, there's also the same sort of challenges with both vaccination and getting back to normal. And I think that's what the theme for 19-0 was, to get COVID down to zero. And we're hopefully, on that path to make it either zero or make it endemic. And over to you, Ja, for your presentation here. And very happy you can be with us today. I want to thank you in advance for what I know will be a very enthralling and exciting presentation.
Well, thank you for the the kind introduction, Scott, and really excited about an aspect of vaccination that is really important, which is really how employers can sort of set good policies to encourage vaccine uptake through conversations. That can happen sort of at the organizational level, but also sort of at the peer-to-peer level, which I think is really important as well. And I won't talk for too long. We'll leave a lot of room for questions. But as Scott mentioned, I found this organization called 19-0, and in this group we have advised hundreds of companies and thousands of other organizations just around things like how to address vaccine hesitancy and how to build confidence in employee populations, amongst others. So can we go to the next slide? Yes. Real quick, we are Canada's largest not-for-profit coalition. We have a bunch of people from industry, but also public health and government and NGOs. And I think that network really is key, because I think that, everybody's sort of out there looking for the right information and the right approaches. Different organizations have different things to offer. Scott mentioned employers are a very trusted source of information, whereas governments may not necessarily be. And I think the more we have trusted voices, sharing accurate information, the better off we'll be. So next slide. Yeah, so this is it's only got a few words on it. But I think it's a really important framing, which is, I think that a lot of people have concerns and hesitancy, whatever you want to call it, about vaccination. I think that's very normal. I think that when we see things like Omicron emerging and a lot of people getting breakthrough infection, people wonder why do we get the vaccine? Or people get reinfected, why do we get this vaccine? And I don't think that, this stems from ignorance. And I think a lot of this stems from everybody, I think, wants to do what's in the best interest of their own health, and they believe they're doing that. And I think maybe one of the most important things is to start from a non-judgmental frame of mind. I think with the vaccination issue in the United States, and also to some extent in Canada, there's been a lot of polarization. And I know certainly a lot of people in the medical field, and which is kind of where I come from, they kind of get judgy, and I don't generally think that serves the goal. And so I think that this is a really important way to sort of view this issue, because a lot of people you talk to may not have been vaccinated, and I don't think that trying to do evil when they do such things. So maybe we can go to the next slide as well. And when we think about sort of what vaccine hesitancy is, I think that really it's best to think about it as a spectrum, right? So on the far left, we are sort of like, I'll take anything with full confidence, right? And there's people like that for sure. And then on the other end of the spectrum, people who like absolutely no matter what you do, refuse to take a vaccination. And I think the portion of people in that category is not actually particularly high. Certainly for non-COVID vaccines, it's not particularly high. And then sort of everywhere in between is, people who sort of, want it more than others, a bit unsure, down to, people who like tend to not want the vaccines, but are like perhaps convincible. And it's been interesting because, even as the pediatric vaccine, so the 5 to 11-year-old vaccine has been rolled out across Canada, the US, a lot of my even physician friends, are, they have a lot of questions around whether or not they should immunize their kids. And so it's not just a thing, that doesn't make you an anti-vaxxer if you have questions about doing these things. And so I think it's really important to recognize these things do exist on a spectrum. Now, I'm going to go through later a lot of ways to sort of like how to talk about vaccination. But I think that I did want to start with sort of the, just the employer's role in all of this, right? And so I think the employers have had to play a fairly large role during COVID because I think that, they've had to educate their employees around COVID and vaccines. I think they've had to really develop policies around, shutting down work and then going back to work. And, this has happened through multiple ways. Some of them have to develop vaccination related policies. Actually, I mean, I think most organizations have some sort of policy around vaccination. And I think that, we're into this Omicron wave, which is like third, fourth, fifth, who knows, some number wave. And I think that, I've seen a lot of employers do this really, really well and support their employees in a really good way. And of course, what employers end up doing has to sort of depend on the nature of the work, the nature of their sort of employee pool. But I think there are genuine or general principles that apply to sort of any organization, whether you're a big bank or you're a meat plant or you're a transportation company. And so I do want to sort of go through these things. And, the first thing is really, I think, to really listen and, understand the viewpoints of your employees. And by that, I mean, I think whenever we think about how we engage in conversations, how we implement mandates, if we do that, or policies, I think knowing what your workforce is thinking about and what different segments of the workforce is thinking about is really key, because that'll begin to sort of inform like where you start with this, right? You could be in an organization where, the vaccine uptake rate is only 30%. And, in that situation, I think, you probably need to do more of a push around vaccine education, and as opposed to one where the uptake is 80%. Anyways, and I think when it comes to sort of listening, like it's really important that we not have, preconceived notions or our employees are thinking. You kind of want to like just get the best, information from them as possible. I think the next piece really is to acknowledge and validate again what people are thinking, whether about vaccination or return to the office or any of those issues. Because, even though I may disagree with you in terms of how safe or effective I think a vaccine is, it doesn't mean that I'm not going to acknowledge and validate your concerns or fears about taking a vaccine, or your fears. I may think coming back to the office is very safe right now, but certain employees may not. And I think that I'm not necessarily going to, it's really important to at least acknowledge the subjective experience that people have. And I think with these two, you can begin to craft policies that are tailored to specific employee needs and employee segment needs. And the last thing I'll say is flexibility and reactivity has always sort of been key, as we sort of all had to experience this pandemic where we go through like up and down waves of lockdowns and non-lockdowns and masking and no masking. And so I think that, at a macro level, I think organizational leadership has to be flexible in how they need to respond to COVID. I think when it comes to, things like vaccination policies or return to office, the more flexibility you have, it's generally a good idea to be somewhat flexible. And I know in a place like Canada, there's a lot of organizations that put in hard vaccine mandates, but they've only done so after a fairly long period of time with sort of exemption processes and a lot of work to sort of address hesitancy when people need that. And I don't think that's very common in a lot of other places in the world. And so really a lot of this is around listening to what your employees are saying about COVID related issues, acknowledging them maybe if you disagree, and coming up with tailored, flexible approaches to sort of address them. And so We can move on, but this is like sort of like a general framework for employers to think about. I'll try to go quickly through this actually, but the next section is really just around how you might begin a conversation, with your peer about vaccination. And so, if you think about a conceptual framework for thinking about what drives vaccine uptake, I think that, the WHO has this framework, the 3 Cs, they call it, the C's in the middle, confidence, complacency, and convenience. And if you go to the next slide, I'll sort of explain this in a second in greater detail. And then there's some other C's they've added. Maybe I didn't put that in. Go back a slide then. Sorry about that. I thought I had something in between. But when it comes to what these 3 things mean, I'll start with, the absence or presence of these 3 factors, I think really drive a lot of uptake, or the biggest predictors of uptake, right? So start with convenience, very conceptually straightforward. And we use convenience, really means access, right? So you can imagine that there's a lot of access to vaccination in downtown New York City, in Manhattan. And there's probably less access to vaccination in, I don't know, like rural Alaska. And so, I think that making the vaccines as available as possible, and that includes both, like having it like present and close to employees or people, but it also involves having policies that enable employees to, take time off work to get vaccinated, or take time off work if they have side effects from the vaccine, or take time off work to, talk to their doctor if they have questions. And so it's more than just having the vaccine in a bunch of pharmacies. And this is something we saw a lot of sort of during the pandemic, and when it came to sort of uptake issues and more vulnerable populations. Complacency, I think, is another really interesting one. And that really is, like, how worried are you about COVID, right? And so I think that generally speaking, if a lot of people around you have died of COVID, or you see really high case counts, then people tend to be more inclined to get vaccinated. There's a lot of exceptions to this, but on average, every sort of like, even at a country level, you would have seen like places like New Zealand and Australia and Hong Kong that had really good COVID control, had pretty low vaccine uptake for a long time, actually. And I think seeing something in front of you that's causing harm is more likely to get you to do something about it. And then the last is confidence, which I think, we traditionally think of as like vaccine hesitance. Do I think it's safe? Do I think it's not safe? But a lot of this is underpinned actually by how much we trust our sort of institutions like government, public health, et cetera, et cetera. And, I think that's why we tend to see a pretty big split actually between blue states and red states. To a lesser extent, this happens in Canada, where you see a bit of a split between people who are, more right of center, more left of center. And this isn't this is not a political attack in any way. It's just, at the end of the day, nobody, including myself, including Scott, who knows a lot more than I do, can know everything about vaccines, right? And so I tend to trust regulators like Health Canada or the FDA, but others who, don't trust public health as much or government as much, and lots of reasons not to trust government, may not. And so it's really these 3 factors that I, when I think about like how do I increase vaccine uptake in a particular population, I try to boost, confidence, try to minimize complacency, and try to, optimize the convenience point. So anyway, now we can move on. Thank you. So this part I think is hopefully, like pretty common sense stuff, but just some general principles about how to speak to colleagues or peers, your friends, family, really anybody, about vaccination, right? And so 4 points. 1, the messenger is very, very important. And by that, I mean, it is probably better that somebody with no medical training at all, that like you trust, that somebody is spoken to by somebody with no medical training they trust, than somebody with, a lot of medical background. So I'll show some slides on that, but like who speaks is super, super important. You want to connect before you communicate, and show some genuine curiosity and concern. And so this links back to the opposite of what I was saying, judgment, bad. On the other end of that spectrum is genuine concern and apathy and validation of their worries and their fears. And then lastly, you want to keep it personal, you want to keep it anecdotal, etc. So we can just go to the next slide. So I think that when I say the messenger is often more important than the message itself. So a lot of people really do trust their, if you look in the left, doctor, nurse, or pharmacist, and people tend to not really trust celebrities as much. And then that's why like big scale influencer campaigns don't work. But when it comes to, how I would think about communicating to people, so sure, people trust their physician. That's great. But people often trust their pastor or their employer, or their, the person they go to, scouts with. And I think that, I think that this is why we can't just rely on healthcare workers to spread the message, because different people trust different people, and the more trusted voices there are, the better things sort of become. Like, when we've done work in rural areas, in any sort of area where there's sort of low confidence, low trust in government, we always try to engage local champions, not like, yes, healthcare workers, but also sort of local community leaders. Okay, next. I feel like I'm rambling on. We can go quickly. In terms of sort of how to build a connection with somebody. And, I presume that a lot of the people you're going to be talking to potentially, or, like you're recommending employees talk to people they already know. And that's like, you're already starting from a good place because there's already some innate trust there. But I mean, I think that, when it comes to these things, you want to sort of get to know the person, their history a little bit, validate their emotion. If they say, like, I really don't want to get vaccinated because one of my friends who got vaccine had a crazy allergic reaction, ended up in hospital. So you want to sort of be empathetic with that, listen to what they're saying. And then, you may want to bring in your own stories, for example. I mean, I think statistics are one thing, but people often at this level make great, like they make conversation around, like stories. Like, like example of a good story would be, my parents were in a nursing home, and I saw so many people passing away. I was quite worried, but then it got vaccinated, and I saw cases, number of deaths, go down a lot, and I was really, really relieved. And so, anyways, I think everybody does have, hopefully at this point, some stories around immunization, COVID, and whatnot. Next slide. Yeah. Yes, I mean, more of this stuff, but don't be judgmental. I do think focusing on the personal benefit is very important. And by that, I mean, on average, I think people respond more. We often talk about like the collective good vaccination does, or the collective return to normal these things do. But I think for a lot of people, and it depends who you're asking, depends what surveys you do, but like how it affects, it's like does this help me? Does this help my child? Does this hurt my child? So personal benefit is important. And then, you do want to directly address things that people are asking about, like, like, does this thing cause myocarditis or whatever, and not sort of brush those under the table if they do come up. Next slide. Yeah, I think that, and something I've also been saying before is that, you kind of, remember like the key message we're trying to communicate. People do make decisions. I can show lots of numbers, but you don't want to make them overly complex. Like an example of message would be like, even though people are getting, like Omicron, the vaccines reduce your risk of death by, almost like not, let's say 95% or something. And so I think you do want to keep it simple. You want to tie it in sort of with stories. Go to the next slide. Oh, yes. And this is like a little framework that we came up with. But I feel like I've talked a lot about how to talk about vaccination. And so, if I were to really just summarize what I said, it would be a few things. One, do not be judgmental and be empathetic and understand where people are coming from. Two, build a connection, really important, and be empathetic. Three, share stories and anecdotes if you can. And I don't think that every conversation will lead to somebody who wasn't going to get vaccinated to be vaccinated. But people are having like lots of conversations, and they're getting lots of sort of information on this every day from the news and from their WhatsApp groups and whatnot. And so I think a positive conversation in this direction can go a long way in somebody to be vaccinated, especially if they trust you. And I think that as employees on average trust you. And like if we're talking about peers, then you probably talk to people you kind of trust who trust you. And so I'll stop here actually and hand it over. I think we're going to do a little Q&A now. Yeah, too many words. We can end my portion of the presentation, Jen. I like and just jump to the Q&A part.
No, thank you, John. This last slide, and for those that are following this, right, we're going to be able to we'll be posting this again so people can read through. rather than voice over this, and then also make many of these slides available. So, I want to thank you, Ja, for a very comprehensive presentation. Where there's a lot of material that's there. And oftentimes what we try to do, of course, in our world is simplify for both employers and business, and what we need to do in both short-term and long-term, and employ some of the strategies. So my first question that we have relates to something that you skipped over, or you said very quickly. And then in some cases, as you know, there are mandates. And Canada has had more of an experience with mandates, at least even for the public, to get on a domestic flight. And that may have motivated other employers and employees to get vaccinated. So can you comment how that has affected not only the response, but also your engagement with the business community and supporting these efforts?
Yeah, it was a really interesting evolution, I think, of mandates in Canada. And so I would say that, if I rewind the clock to about April or May of 2021, the dominant narrative was that mandates were not good because, they sort of were too much of an encroachment on sort of personal, freedom and choice. What kind of happened, which is kind of strange, kind of happened all at once, is that over the summer, you began to see more interest in mandates from the health community, the business community, and then government. And these three sectors kind of started feeding on each other. And so, I think a lot of businesses were wanting governments to enact mandates, and governments were kind of waiting for businesses to enact mandates because they didn't want to be, on the hook for enacting mandates. And then there were some, early announcements around, the federal government saying, sectors regulated federally, like transportation and some forms of, banking essentially would require mandates. But it, and that led to some companies starting, but then other companies would kind of just jump on board. And when I see a mandate at this point in time, we're not talking about when I say a hard mandate, what I mean is that somebody needs to be immunized or they will be eventually let go, or go through a disciplinary process. I mean, like vaccine or test, which I think is actually a fairly benign type of mandate because I don't think people have as much issue with testing. And then, things kind of just snowballed from there. And I think that as we headed into the fall, there was a bit of an uptick in cases. We began to see some of those mandates facing, like consumer facing mandates, like going to restaurants or going to bars. But so it wasn't, an interesting evolution where people, I think, went from pretty anti-mandate to pretty pro-mandate pretty fast. I think that when it came to individual companies and considerations for them, I'd often say a few things, right? So, people often think that mandates are used to increase vaccine uptake, and I view that as a secondary reason for mandates. I mean, they can for sure increase vaccine uptake in a specific population, but I actually think the primary mandate for mandates is actually to keep a workplace safer. And so, I mentioned the example of nursing home, where I managed hundreds of nursing home outbreaks, and there was a massive drop off in, cases, deaths as soon as we had vaccinations in there. And you can imagine that, a mandate there might be useful because if somebody brings it in, it can really wreak a lot of havoc. And so, as organizers think about that, I think it's important to think about, what is the risk of having a low vaccination rate from an employee health perspective, from an operational perspective as well. I think another thing to think about is where are my, as I mentioned, where are my employees at? Right. And by that, I mean, if, you're a company where 20% of your employees are vaccinated, you mandate that you're going to lose a lot of workforce. Although interesting enough, when people do tend to operate hard mandates, at least in, lots of Canada, but the US, parts of the US, you don't tend to see a lot of people leaving their jobs. So anyways, knowing your workforce, what that's important, knowing the milieu around you is easier for companies to mandate this stuff, the more government mandates existed. So I could ramble on and on about mandates forever, but I'll shut up now.
No, appreciate it. And it's interesting you mentioned the milieu around your company. And as we've seen in the last weeks, we have, Italy, Austria, France, and others that are moving mandates in different ways and giving both financial incentives and disincentives. Similarly, that's happened in the United States with some employers. Some are giving financial incentives to get vaccinated, or the disincentive in the form of insurance premiums being higher. So, given what you've heard on all this and have seen, what have been some of the biggest incentives or disincentives that you think may have been making the difference to help motivate both employees and employers to get to a term that, on the second part of the question, is what is fully vaccinated for an employee?
Yeah, so I mean, I think that when it comes to probably the single most effective tool to get employees vaccinated is a hard vaccine mandate. But I'm not necessarily a huge fan of these in all settings, because the operation side matters a lot, right? Like if you lose 5% of your workforce, that's going to wreak havoc on a lot of your operations. But that, when companies have implemented that, what tends to happen is that people get vaccinated, a few people leave. But I mean, along the way, I've seen, at least in Canada, so that's one, I've seen fairly large financial incentives. A lot of our energy companies were offering more than $1,000 per vaccine. And I think that just speaks, and that's a hell of a lot cheaper than having to lose people who aren't vaccinated, I think. And then actually for, and there's sort of a mixture of these consumer / employee type mandates, and the one where you had to be vaccinated to fly actually is a mix of both, right? And so I think that for, again, in the province I come from, there's sort of remote energy type work happening, and so to board a plane you would have to be vaccinated, and that sort of helped a lot. But I mean, I think that the best approach isn't to just be okay, we're gonna put a mandate on you, nor is the best approach to be come what may, come hither. It's really to understand, Scott said, the area and what your employees where they're at.
So good points here. And we have a question in the chat. And again, Business Partners Convention is a global initiative. So the ideas that you're giving for both energy companies and others, both in Canada and the links of what you shared with Cleveland Clinic Canada, those slides are quite excellent. And one person in the chat has mentioned that very good that you're reminding that vaccine hesitancy doesn't stem from ignorance. And the question is there were a lot of correlation with the level of education that we've seen in surveys. And I know you've published a number of surveys in the global press, not only cross-sectional in Canada, but others that you're engaged in globally. How are you familiar with this understanding in society? Is there really a myth that hesitance and ignorance, in your opinion, are overlapped, or is there a way to really break this apart and use the term vaccine literacy or other areas that we have tried to do with business partners to convince?
Yeah, I mean, I certainly I think when you begin to link vaccine uptake with things like education or race, there's a lot of correlations there, or with any number of these other things. I think you begin to potentially create, I mean, surveys will show what they show, but I think it's important to look for the underlying reasons driving that lack of uptake, right? And it's not for, I think a lot of that has to do with those, 3 C's that I mentioned, right? And so, if you don't trust public health or government, and lots of people have reasons not to trust government and public health, uptake is going to be lower. And I just talked to one of my colleagues about this yesterday, and I'd love to hear your perspective, Scott. The sort of judgy atmosphere that exists is really painful to me. When my physician colleagues are maybe we shouldn't treat unvaccinated people in our hospitals. I think that's kind of crazy. And so I think that whatever we can do to sort of diffuse the polarization, and that starts by not stereotyping and judging people based on sort of macro demographic categories and why they aren't getting vaccine. Right. But Scott, I feel yeah, what do you think?
Well, thanks for asking. I mean, a lot of work that we've been doing is trying to focus on trust, and not only the work of the USCIB Foundation on trust in general for businesses engagement in the Sustainable Development Goals, for example, or nutrition or other areas. We know that trust is the factor, and you hit it well, that business is the trusted source for getting people to make decisions and to follow in the goodwill for everyone in society. You also had a slide though that showed the physician was very trusted and not the celebrity, and yet we've had mixed pieces of celebrities, if I can say now, to put the timeliness on this event. We just had the Australian Open, and Novak Djokovic became a global star as an anti-vaxxer, if I could say that. Cost him a lot of money, and also showed the diplomatic row and immigration issues. Similarly, south, not too far from where you are in Green Bay, the same thing with the former MVP quarterback, Aaron Rodgers, who refused to vaccinate and also, caused some issues. So in some ways, are there ways that, yes, you mentioned we want to build trust in business, and we have that continued element of the employer. And maybe now that we realize that celebrities could cause more harm than good in some cases, what's this new secret sauce? What's the new element that's going to get from people in the United States, where less than 2/3, they're better off in Canada, many European countries and others who are listening here, it's well over 80%. And yet we know 80 countries are below 10%. So what is the element now that we're a year and a half, into the height of the pandemic, and we have over a year now of vaccines? What is it going to be to get to the level that we end this emergency phase, are in the recovery phase, and eventually in the normal phase?
Good question. You mean what level of what does it take? Well, I mean,
what's the secret sauce to get the you've seen it in different levels here.
Yeah. I mean, I think what you need, oh God, this is gonna just sound so generic and floofy, but this is I've seen groups that would have very low trust in government. Let's say, polls would say 45% uptake, go up to 95% uptake. And these are groups that did not trust government, right, initially. And I think for that to happen, you really do need to build, I'll say, trust, access, and concern. And to do that, what you need to do, I think, is mobilize a ton of trusted voices. And this isn't, and when I say mobilize and trusted voices, I mean, I would say that, you don't start with telling people to get vaccinated, right? So again, I help manage some of these big meat plant outbreaks. Like you may have heard, in the US, they had Tyson, JBS, Cargill, these outbreaks are generally staffed by people who are, newcomers to the country, racialized, don't speak English that well. And, our relationship started not by us saying, get vaccinated. That actually started with us supporting people with income support and getting them food when, they were off. And that built a lot of trust, because they're like, oh, you just, come on, get vaccinated, helps you, doesn't necessarily help me if I don't trust the vaccine. And once you build that initial layer of trust, then you can begin to broach the vaccine conversation. And to do that, you always want to sort of engage people that are already trusted, right? And so, in many ways, I think this is not maybe too dissimilar to a US election campaign, where, there's a lot of pros and cons of it, but, you tend to mobilize broad sector society to share a message with people. And, it's not just healthcare. It's not just people like Scott and I, it's people religious leaders and business leaders. And, they're going to and then you try to get down to the point where individuals are having conversations with other individuals, which is kind of akin to door knocking during a collection campaign. And doing that, I think, is sort of really key to building that, to just having people saturated with trusted, accurate messaging.
Great. No, you answered that very well. And I think that the focus on trust is really key. So before we turn over to some more resources, there's one other question that we received here. And it is about employers providing incentives for those who are getting vaccination, or a work environment that only vaccinated people who come to work. So the question is, what works better? If unvaccinated people need to pay for their own PCR test on a regular basis in order to enter work premises, or if you just have, a work that pays for it and makes certain of it. And they're referring to, a government policy that there was tension of vaccination proof to get on public transport, no rides, no way to get to work. So you had to pay for it yourself, and then to be negative if you were not vaccinated. So the question is, what the last sort of, this may be a short answer. What's better, the incentives or the stick?
On average, I think sticks work better, but I wouldn't say so. I've been asked this question by so many large companies across, and I'm like, it kind of depends, right? So, if you think on average, distant sticks, I think actually work better than incentives. Behavioral economics would suggest that, but I think if you do that too much, then if you get your employees all really pissed off at you, that won't serve your purpose, because your goal isn't just to get vaccination rates up, is to get that in a way while maintaining some degree of harmony in your organization, right? And so, it often starts actually with trying to get some data and serving employees. I feel like I keep on saying that, but it's really true. I'll comment on the Philippines bus policy, which is really interesting, because I think that one must be careful when they implement that type of, that's a pretty hard mandate, right? You can't access public transport unless you're vaccinated. And before you do that, I think you really got to make the vaccine widely available, to understand the implications, of doing so. How many people will you should have leave out? Because if you don't, you again, government's goal is not just to get people vaccinated; it's to provide in this case, a good public transport system so people get to work. And if you totally nerf that other goal, just in the name of vaccination, that may not be the best thing to do. So be careful. There's no one size fits all, but it's also not sort of that complex in that you can look to other jurisdictions for examples how they've done this, and the methods in terms of how to know what to do tend to be similar in terms of consulting the community and getting a sense of what your employees want, and then you build sort of your policies based on that. So, great question.
Great. No, I mean, it's and great final remarks. That it's data-driven, science-driven, theory-driven, but yet keep in mind whether it's business goals, harmony that you use, keeping the trust that you're giving the right information, and balancing the right approaches in the best interest of the employee, the company, society, the customers, and so forth. So, very comprehensive job. Thank you again. As I said, I know you would have a presentation that was both comprehensive, but also you're speaking from your heart and experience. So thank you again today. I'm going to turn it back over now to Jen Falcon, who was the voice at the beginning of this, and now we hear and we'll see the great work that Jen and the team have put together at Business Partners to Convince.
Thank you, Scott and Ja. What a great presentation and discussion. I think, Ja, what I really took away from today is that there's a real human approach, and that speaking one-on-one and really coming to individual employees from where they are is very important. I'm going to take you through the Business Partners to Convince website and the resources available to you. Kira's going to post some direct links so that you have direct access to them. One of the key things in preparation for this discussion we had with Ja is he thought it would be very important to give you some check sheets and some sample policies that you can use, whether you choose to have a voluntary or mandatory vaccination policy in your workplace. And our steering team partner, Sherm, has collected those for you, and we are going to put that in the chat. So you can go to our website at any time, businesspartners2convince.org, and you'll see right on the homepage that our top nav gives you access to a wide range of our content, which includes who we are, our network and partners, our employer resources section, which I'll take you through in a moment, our challenge toolkit, which is a toolkit that provides creative assets for anyone who signed up for our workplace challenge. And I'll take you through the challenge as well. Our very robust press section, which not only includes press releases, but also academic journals and all of our webinars, and our team. And if at any time you're looking for a specific content area or you want to search by an organization or company, our universal search bar will let you do that. In fact, when I search on 19-0, you'll see that we've created some very important resource documents in partnership with the 19-0 team with vaccination FAQs and what to know about COVID-19. So we're really grateful for our extended network and partners for helping us create and consolidate a great resource site here for everything that you'll need as an employer. Our homepage obviously lists our mission, but it's going to give you access to join the Workplace Challenge at any time. And this is the first step we'd suggest you take, whether you're an organization or company that has any level and quantity of employees. This is our global COVID-19 Workplace Challenge, and it's centered around 5 principles, which really tie into Ja's prior presentation on the sincerity and approach we want to take as employers to help support our employees. And let me read this to you. When you join the challenge, you're part of a global movement of employers of all sizes that are looking to do what's best for their employees to help support them in getting vaccinated. So one is listening to employees' needs and concerns about the impact of COVID-19. They agree to follow the latest public health guidance to protect not only themselves and employees, but also their workplace, customers, and community. 3, to promote vaccine literacy based on the latest scientific evidence, to encourage vaccine confidence and uptake, and to build confidence in the vaccination, not only in the individual workplace, but also across the broader network and communities. And you can see it's very easy to fill out the form and join our organization. And at any time, you can click on our network and partners to see the list of organizations around the globe who have already signed up for the challenge. Our homepage will also give you our latest news and resources. The most recent 3 content pieces are always here on the homepage. We have our op-ed piece that Scott wrote in January around reflecting on the future of COVID-19. We have IOE's global guidance for employers that they just announced in January, and also the most recent Gaslight Health workplace documents. And of course, we always have our workplace challenge prominently on our homepage and our Twitter feed, which you can access directly from the homepage. Of course, we prominently promote our events, including today's session. Let me take you on to the employer resources page. It's a very robust list of documents. You'll see it's very easy to reach out to our team. Kira, as the Deputy Director of Marketing and Communications, can be reached directly. You can also access an archive of all of our business partners to convince monthly e-newsletters here. Our employer resources section includes documents that we've created in partnerships with, say, 19 to 0, myths and facts, steps to increase vaccination rates, also communication strategies. Click on each link and it'll take you right to an article about that document with a download for the respective PDF. Our business case studies includes not only employer reactions in support of the vaccination, but also other ways that they've tackled the challenges of the pandemic. These include Deloitte's aiding communities affected by the pandemic, Apple and Google partner on contact tracing, and Amazon in their support of employees, customers, and communities. Scroll to the bottom of every page and you can always click on Load More to continue to go into our archives and scroll through all of the available content. If you click on partner content, you'll see a wide range of resources that we've consolidated from the most factual and expert opinions and documents. These include the SHRM resources that I just mentioned, International Association of Employers Guidance for Employers, Gaslight Health. We've also consolidated more global resources in a wide variety of languages, including the European Vaccination Information Portal, available in all EU languages. And this is our shot from Canada, which has 30 languages available. Again, if at any time you want to continue to go through our archives, click on that Load More button at the bottom of the page to access more resources. I'm now going to click on our press page, which, as I mentioned, not only includes all of our traditional press releases announcing our partnerships with NFID, Immunity Chicago, and other organizations focused on the same mission. We also have under our publications a number of academic journals that Dr. Scott Ratzan has been deeply involved in, American Behavioral Scientist, Communications Medicine, and our other steering team partners like Business Fights Poverty. Our podcast and media section is incredibly robust. We have a list of articles where Scott has been featured, also other podcasts, a list of all of our webinar participation from around the globe, TV spots like BBC, And we've represented our participation across the Middle East and North Africa, the Caribbean region, Europe, and around the globe. Again, if at any time you're looking for a specific topic or company or organization, use that universal search bar to identify all of the relevant material available for you. So there's a brief tour of our website. We really recommend that you take 3 steps today. 1, please join the Workplace Challenge. Be a part of this global movement that we're creating. And it will also give you access to further trainings and materials and get you on our e-newsletter list so you can stay abreast of all of our global activities. You can leverage the SHRM resources as well as anything on our website to help establish a clear policy for employee vaccination or to improve and adapt the policies you already have. And you can leverage the available resources on both the BP2C and 19-0's websites. And Kira will post all those links in the chat to develop any additional strategies and approaches. I'm going to hand it back over to Scott now, and he'll help close us out for the day.
Thank you, Jen. And that was also quite comprehensive, and it's very difficult to go through a rich website in 10 minutes, and hopefully people will have the time to surf, shall we say, themselves and get the information they need. I think this has been a very interesting discussion today. I'm hopeful that all of you have come away with actions that you can do. Of course, we always mention to join this Workplace Challenge. You see we have it in Spanish. We just did this a presentation globally, as this one is meant to be, but particularly with the Latin America focus. Clearly, there are opportunities in many places of workplaces, large and small, to adapt these principles and to actually engage. The other piece that I thought was quite important today that came out is, again, the importance of trust, how one builds trust, maintains trust, attains trust, and then continues to advance that together with people who they work with. And with that, we will continue to focus on trust with our USCIB Foundation efforts, as we know that is really key to getting us back to the new normal. I don't want to even say build back to before the pandemic, because I think our world will continue to have epidemics, and hopefully not of the same pandemic proportion that we've had with COVID. So with that, I would like to also thank Kira, if you have been active in this chat. If not, we'll figure out a way to make all of these resources available as an appendix as we're rebroadcasting, if I can say that, or having the opportunity for people to see and interact with this webcast in the future. And this training module, amongst others, is only part of an ongoing effort with business partners to convince of what you've seen here today, and all of us who are both behind this, shall we say, with both our steering committee, this global network that we have of employers and chambers of commerce and others, as well as, of course, all of you who are listening today that have your own networks. And would like to thank those of you who have participated and have had not only just the logos, but your personal expertise and, frankly, our unwavering support to build both a vaccinated world, not only as we're working to help do that to stem COVID, but also the diseases that we've nearly eliminated from the planet. I say that with polio. We have eliminated certainly smallpox, and we learned to live with flu and other childhood and other adult preventable diseases. So we're in this together, and we're really proud, shall we say, to be leading the business arm or the private sector arm with Convince. And want to thank all of you today for participating, and remind that there's no cost to joining the challenge. There's no cost, financial cost, to working on any efforts with us. In the end, what we're trying to do is rise up for everyone to be healthier, happier, and live in a better world. And with that, I am going to close and remind that you have an opportunity to email us, to engage with us. All the information is there on that businesspartnerstoconvince.org website to reach us, to recommend new training elements on how we can participate with all of you in the efforts that you're also doing as we're advancing, again, a better world together. So with that, I think we're right within the parameters as I looked up at the time to say thank you, and I will close this Business Partners to Convince 19-0 webinar that we had today, and hope in the future you communicate well both internally with your company, amongst company peers, amongst your community, family, and friends. So over to a back to Jen to close out for Business Partners to Convince.
Thank you, Scott and Ja. This concludes our Business Partners to Convince training webinar. We thank you, and we look forward to staying in touch on meeting this important challenge.